On Wednesday, 21st of February 2018, Kayla Savory and David Kidd, together with Chris Thorne and Sakina Babia, walked around the hospital and the community care centre. This walkthrough was to review the various areas of the health service to establish the cultural safety and cultural appropriateness of the artworks, posters and other aspects of the health service. Current positives and areas for improvement were identified to ensure this health service is providing a culturally safe and appropriate environment for Aboriginal and Torres Strait Islander patients, including their families and friends, to receive care and treatment.
Sometime there's going to be people in there that need to experience what we've just had a yarn about and talked about. They might think that they're doing everything right, and they probably are. But have they started out here? Because this is where it starts. This is it. For community, well, it starts before we even get here. So if we can't... This is what's beautiful about here, is in the 6 years so much has been done. But there's still a lot of places that don't think they need to come out here and have a yarn because, we know everything.
Starting on the outside of the health service, including the main entrances and main reception at the hospital, these positives were observed. The acknowledgement plaques at each entry point, new flags on flagpoles, the glass doors able to see the health service and into the health service before walking in, desk flags displayed, artworks displayed with description beside them, waiting areas and a welcoming environment. Future improvements include placing an Identify and Be Deadly sign on the entrance into oncology and medical imaging, considering the colours and design on Identify and Be Deadly sign. Within the emergency department, the positives identified were newspapers, the Courier Mail in the waiting area, pamphlets displayed, artwork displayed with description beside them, and smart time undertaken by all staff, where this is a safe space to ask questions. Future improvements for the emergency department include asking the question training for triage and front reception staff, an explanation of the North East Health Wangaratta emergency triage process to be displayed in plain language on the wall in the waiting area for patients to refer to. Different triaging processes are in place across each health service across the region, and there is no standard procedure. Coming to emergency is usually during a high stress situation and environment, therefore easy access and in plain language would make it easier for patients to see and understand the processes. Future improvements for ambulances and ambulance entry point is asking the question, nurses to ask if it is okay to do vitals on men and women, respecting the dignity of the patient and bedside manner in terms of women's business and men's business. The positives identified for the cafe are good food and the space works well, and also that the poster on the outside of the cafe entry is great and it's a subtle hint to Aboriginal and Torres Strait Islander people. The outpatients community care centre and dental waiting area / reception and the outside of this building, the identified positives were acknowledgement plaques at entry points, the gardens around the building and entrance, seats outside the entrance, artworks displayed with descriptions beside them, and desk flags are displayed. The future improvements for this area are placing an Identify and Be Deadly sign on notice boards in different areas and utilising the lift space for posters and notification of various special events. The general/overall comments for this health service and the positives identified are that so much great things have happened at this health service over the past 6 years, and having this conversation and walkthrough with Chris and Sakina is very important. The future improvements include the security guard's approach, sitting down next to clients rather than standing over them, bedside manner, talk to the patient in plain language and with respect, no medical jargon, keep it simple, empower people with knowledge through knowledge without embarrassment, displaying signs and posters on notice boards, poster of and list of significant events and meetings placed on notice boards throughout the hospital and community care centre to increase awareness and understanding and knowledge about these particular dates. This walkthrough with Chris Thorne and Sakina Babia is an integral part of understanding the cultural safety and cultural appropriateness of this health service and will help update and inform the Pangarang Nangara plan.